The Epley Maneuver is a simple four-step physical therapy maneuver that is used to treat the most common forms of BPPV, posterior canal and anterior canal BPPV. The goal of the Epley Maneuver is to migrate the otoliths, also known by many people as crystals or stones, out of the canals of the balance system. The removal of these otoliths from the canal is what alleviates positional vertigo symptoms. If you have neck, shoulder, back pain, or other physical limitations, it is not recommended that you try this maneuver without medical oversight. It is likely that you will experience dizziness during this maneuver, which is a good sign that the maneuver is working. Some individuals do report sweating, nausea, and occasionally vomiting. Before you begin, you should determine which ear needs to be treated by completing the Dix-Hallpike maneuver. See our separate Dix-Hallpike video on our website or on our YouTube channel. The first step of the maneuver is completed by sitting upright on a sturdy surface, such as a bed, couch, or floor, with a pillow behind the back. The individual will turn their head 45 degrees towards the ear to be treated. If turning the head to the right, you're treating the right ear, and if turning your head to the left, you're treating the left ear. Then the individual will quickly lie back over the pillow and hang their head off the pillow in a head hanging positions for 30 to 60 seconds. A brief sensation of vertigo lasting a few moments to 60 seconds will likely be felt during each position of this maneuver. This is a good sign that the otoliths are migrating out of the canal. It is important that the individual not quickly sit up or change their position outside of what is directed in this maneuver, as it can disperse the otoliths into undesirable canals, making treatment more difficult. Each position should be held for 30 to 60 seconds. If vertigo is reported, the individual should wait until the vertigo has subsided and then wait the 30 to 60 seconds before moving to the next position. A quick head shake can be completed to help the otoliths migrate. Continue to hold the position a little bit longer. The second step is to rotate the head away from the ear being treated without lifting the head. Brief vertigo may be felt but should quickly subside. You will hold this position for 30 to 60 seconds. It may be helpful to have a second person in the room to keep track of time, since the person completing the maneuver will not be able to lift or move their head from each position. Another quick head shake can be completed, and then continue to hold the position a little longer. The third position requires the individual to tuck their chin towards their shoulder that they're facing and roll onto the side away from the ear being treated. So in other words, turn in the direction that the head is currently facing. You'll tuck and turn, and try not to lift your head when you do this. And rest your forehead down so that your chin is tucked. Hold this position for 30 to 60 seconds. Once again, a quick head shake can be completed. Continue to hold the position a little longer after that. To sit up, you'll kick your feet forward. Use your hands to push yourself upright. Bring your head to look forward as you do. You have now completed the Epley Maneuver. So now you've successfully completed an Epley Maneuver. You're going to want to do this 3 times with a 3-minute break in between each one. So you'll do the first Epley, wait 3 minutes, a second Epley, wait another 3 minutes, and then you'll finish with the last Epley Maneuver. Throughout these maneuvers, you should notice that your vertigo gets less and less, or is completely alleviated as you're going through each of these positions, which lets you know that you are making progress. For the 24 hours following the Epley Maneuver set, you're going to want to refrain from bending over, from shaking your head, and from laying on the side or the ear that you just treated. If your symptoms continue to be bothersome after about 2 weeks, it is a good idea to seek medical professional opinion on your dizziness symptoms. If you have any questions, please visit our website at dallasear.com, and we'd be happy to take care of you. Be well.